Right, so we have a 35-year-old male that was crossing the street when the car ran the red light, struck him. He was thrown onto the hood of the car and then fell on the ground, lost consciousness. EMS found him combative and confused. All right, so let's get started. First, let's stabilize, insert IV, whatever, chest x-ray, pelvis, fast ultrasound. Let's do a procedure. Let's put a C-collar on him, just in case. You just want to do that during trauma, just in case there's a C-spine injury. Let's show what the X-ray showed. X-ray showed, okay, so there is a pelvic fracture, and then chest X-ray is normal. Okay, so we do want to put a pelvic binder on him. Let's get extravascular access. So second IV, let's give him some blood. From here, let's do some examinations. Let's do everything. Let's do everything. Oh, and we should probably intubate. Let's see what he has. Anything crazy, neurological. Anyways, we're going to do a head CT. Nonetheless, confused, lethargic, withdrawing to pain in all extremities. Okay. Let's see, hematoma of the right parental scalp. I don't know. I don't know why I'm blanking on that. Okay, let's intubate. So let's intubation, prepare for intubation, endotracheal tube, suction, pre-oxygenate, and his blood pressure's low. Let's do ketamine and let's do rock, and then let's do a rapid sequence, so fast sequence, and then let's give him a ketamine infusion so he stays asleep. I remember I missed that last time, so I have to remember to do that, or a propofol drip. And then let's investigate. Let's do ECG, finger, blood glucose, cardiac. Let's do lung. I don't think we have to do a lung, but I'll just do it in this case. Actually, no, I won't, because the chest X-ray came back normal. And then let's do basic chem. Let's do blood type and screen because he's most likely going to surgery. And then coag panel, because surgery again, CBC. And then let's do some imaging. Let's do abdomen. Let's do the C-spine so we can clear that. Let's do a chest and let's do a head. And then let's perform. Okay, ECG, sinus tach with ischemic changes. Mark left axis deviation, abnormal. Okay. So let's check everything here. White blood cells we expect to be high because his body's under a lot of stress. Abdominal. Okay, so there is a retroperitoneal hematoma. Me pronouncing this is not the best. Retroperitoneal hematoma. C-spine is clear. Chest CT is clear. Head CT is clear. Okay, so we have some diagnoses here. So 2 diagnoses. Let's go to trauma. Let's figure it out. Okay, pelvic fracture for sure. And then right here, retroperitoneal hemorrhage. That's the same thing as a bleed. And then let's intervene. Let's give him. I've seen this in the emergency room. They give TXA when there's like a trauma. That's when they give TXA. Which is it like helps clotting. So if they're bleeding a lot, it will help clot, and so they don't bleed out. Apparently, it's like good for like mortality rates. And then let's consult trauma and pelvic. So let's do orthopedics. And the C-spine is clear, so let's just take off the C-spine collar. Procedure, remove the C collar, and then let's send him off to the operating room. See what happens. Okay, 97.8. Honestly, that's actually really good. So we messed up on the stabilization, which I'm not sure we messed up. So removing the C collar was harmful for some reason, but we cleared the C spine, so I'm not really sure why it was harmful. Um, yeah, but everything else was pretty spot on, and I'm pretty happy with that. Let's see the detailed discussion, and you guys can all look over this as I'm going. So yeah, TXA should be given for traumatic hemorrhagic shock. Patient is confused, concerning for intracranial injury. That's why we did the CT scanner emergently. Um, and you can pause this as we go down. There's a bunch because it's trauma. That was detailed description. Our diagnosis were pelvic fracture and retroperitoneal hemorrhage, and we prepped him for the emergency, the operating room. Sorry, I'm speaking way too fast. Um, and out of the case was pretty straightforward. Something you would typically see in the emergency room. Get him to the emergency room, um, and get him to the operating room. Given that they had this pelvic fracture and the retroperitoneal hemorrhage, and yeah, this has been Shavan Patel, and thank you.